So, Jim, do you have any questions, thoughts, or concerns? One of the things you didn't bring up was cost. Are you independently wealthy, or would you like to discuss cost?
I was afraid to ask.
Well, don't be. It's I actually am pleased to tell you that the way we work this is to start low and work up. You can't start at the top usually anyway. You've got to kind of work into this.
Mm-hmm.
So we use a graduated progressive attack, if you will. You just have to take for granted that what I'm saying is true, but you'd like to test it. Most people don't feel comfortable just buying the whole farm if they've never raised a tomato, so it's better. Or want a dog, in spite of Jeremiah being an older dog, you might want to hold a puppy first and see if you like dogs at all. And so basically we found a way to do that, and in that we start with a trial appliance, something that's very user-friendly. See if you like appliance therapy, and usually you get a pretty good bang for your buck. And then we only do the lower, and you probably need an upper. So the ultimate, and that is decided as we're going along.
Okay.
I will tell you that in your case with the sleep and where we're wanting to go, you also need something that's this is an upper and lower. I just took my lower out, but I'll put it back in for a second. We use orange as our color, so they're easier to see. But the appliance that I wear lifts the tongue up and lets it lay on it.
Okay.
But a lot of times the tongue will then hump up in the back, and so this is my upper that I'm working on that pushes the tongue with the same contours from the top down and pushes it out the front.
So it kind of balances it.
It does. It's kind of odd, but at the same time you're already missing. I am where I had a tooth removed. It was a root canal tooth, and I have full coverage of that area all day if I'm wearing that.
Mm-hmm.
If not, could put a partial in there or an implant. But the implant has to deal with the bone loss around here. This does the job, and I can cut the labial bar completely off with this new material. But it's much more flexible and withstands forces if I leave it on.
How about eating? What do you do?
Oh, you can't eat anymore.
Okay.
That's how we lose weight.
That's how I lose weight, yeah. Okay.
No, you just take it out to eat, but put it back in to breathe.
Okay.
So it's for that period of time that you're eating, you can take both out, put them in their cases, and then put them back in after you eat. But the concern I have is that you realize ultimately we're going to have a top and a bottom at night so that it positions your jaw forward.
Just at night? Or?
Well, right now you're sicker than you think you are. I showed you were standing up and not getting any air. So until there's some change, I would suggest considering it even during the daytime as much as you can. When you're working and you're not trying to impress anybody or talk to them, this is a piece of cake.
Okay.
If you're going to have a conversation on the phone or something, you might want to take it out. Just use the other two.
That's what I was going to ask you. Is it easy to pronounce words with all that in your mouth?
Sure. I'll put this one in, but it's not mine. Mine's
well, yeah. So you can still, it's adjusted so you can still
listen,
speak.
it's a question of adaptability and perseverance. It's I would lie to you. I'd rather not wear mine during the day, but when all hell breaks loose, I want to wear it because I'm getting oxygen and I can deal with the situation. Calms down, my wife quits pushing my buttons, or kids quit calling with all these problems. Then I go to my other appliance. This is all I need right now.
Okay.
If I go home and my wife presents me with something, a dilemma at the door, which she knows not to, but if she does because she's all distraught, I usually put both appliances in, or the nighttime that I use during the day. And that's the only way I got really well, was using the appliance during the day. That was specifically intended to move the jaw forward.
Optimally, you are to use this as much as you possibly can.
you will find that it's more, the question starts changing into why wouldn't I? If it takes care of everything you just laid out there, back pain, especially when you go to bed, you're going to want to wear that to prevent that chest pain you were telling me about. But
how about my CPAP?
Well, we're going to have to work with your doctor on that, and I need the sleep study first before we even consider substituting it for the CPAP. You have to do that with his blessings. I don't take people off oxygen. That's prescribed,
okay. Well,
item. So basically, we can go to him and say, just like my friend did with the Boy Scouts. Listen, I know, you're real keen on CPAPs, and I'm wearing one, but I would like to do. In fact, you can go to his it's a pulmonologist. It's ENT. That's got the clinic. And he's very anxious to see some more patients. He didn't care whether they get a CPAP or oral appliance, especially an oral appliance lets you be untethered. That was one of your goals. Wake up and not be foggy, and to have all of the possibility of getting off your meds for.
Well, my doctor is the VA.
Oh my gosh.
So.
Yeah.
And that's that sleep
thing.
Yeah, it was at least 6 years ago.
Yeah. So it would be good to see a study. You probably qualify then for a study that would let you have your CPAP and then basically see if oral appliance can beat the pants off of it, and that'll give you complete freedom. Treat yourself more than just 6 to 7 hours at night, and we can make all this stuff for daytime. There's no problem with that.
Well, I've often been concerned that if the power goes out,
you go out.
I go out. Yeah.
Yeah. Nobody talks about that.
Yeah.
It's being like on an iron lung, and all of a sudden there's no juice.
Mm-hmm.
So this and the other one that I'm wearing, that set's $5,300, and then this alone is $8,600. That's an upper and a lower with that hinge mechanism.
So
and
83 and 53?
Yeah,
okay.
86 and 53. But to get you started, since you have lots of questions about it, and we know we're going to get some changing in your symptomology, we can start even with just the lower, knowing that you're not finished till you get the upper. And you have a possibility of stopping there for a while, or moving right on into this guy to really go after the cardiac and cardiovascular symptoms you're having. And may you never know what you're avoiding. You said you already had cancer. Let's give that body some more oxygen.
Yeah.
And I think your autonomic and your autoimmune system, both of them will perk up a little bit, and you have a better fighting chance.
Okay.
Air is pretty critical, and that gal that we just put that lower in will tell you and talk your ear off about that. So, we're going to start low and work up.
Okay.
Put you in a trial appliance, and then change that to a treatment appliance, or a diagnostic appliance to a treatment appliance, and then we'll know how you do with those two, and if we hinge them together, and we have an in-between where we have a trial appliance too. Instead of going to the most expensive, we can try something that is less expensive, but not quite as easy and as effective to wear as this balance. Some of that depends on your pocketbook and your experience with this. We are 85% successful. So 15% is not bad. If you're in that 15%, you sometimes get enough results where you're not upset. But that's pretty good results for the kind of patients that we see.
That's big.
That's bigger than big.
Yeah.
I've never seen anything like it. When we were doing a lot of things with patients, alternatively, we had get 40%, but we couldn't get 85%.
Wow.
I think this is getting closer and closer to the core of the problem.
Sounds like it.
All right. Are you ready to act, or is there some reason or answer that I can give you that you haven't had yet?
With what you've shown me, I can't afford not to start.
Okay. Well, if you have any problems or questions with that along the way, we do have Care Credit, and we do, by making the work progressive and breaking it up into steps, more affordable, in that you can kind of hold yourself in one place till you can work your way to the next one.
Okay.
if you're able to do it.
As you see, Jim totally gets it. Jim totally sees the value of balancing his oral system and how it will help eliminate and help him begin to eliminate his ailments and his symptoms. So we will make an appointment for him in the morning. He will come and we will get a baseline of his vitals, his blood pressure, his pulse. We'll take impressions, make diagnostic models. We will take photos of his posture and begin the process. And by the end of the day, he'll come back then again for a 3 o'clock appointment, and his first appliance, that training appliance, will be ready to go, and Jim will be on his way to feeling terrific. So this is great information. You will have cliff notes on how to do this consultation in a shorter period, but we want to make sure that you hit the handful of vital questions that need to be asked during the consultation. So we have cliff notes available for you, and then as you get comfortable and you see the value of this, then your consultation will grow and you'll add in a few of your own questions. So thank you very much. This is awesome opportunity that you have.